cracked tooth syndrome. So it is also known as incomplete tooth fracture. So cracked tooth syndrome or cracked tooth odontologia is not exactly fractured tooth. It's an incomplete fracture mainly of your premolars and molars, like your back teeth, which can occur due to many reasons. So why it is known as cracked tooth syndrome? Because there was this guy Gibbs who actually was eating something very hard and he felt a very piercing pain in his molar. So that time doctor told him that your tooth has cracked. So that from there the name came as cracked tooth syndrome. So whenever you are eating very hard, there's a if you feel the piercing pain or a sensitivity, then it can be a cracked tooth syndrome. Then you should go for your examination or your X-rays if required. We have three layers of our teeth. That is enamel, dentine, and pulp. So when we have incomplete fracture, the cracked line is still dentine. So mostly dentine is affected, but occasionally it can extend to your pulp. And if it goes to your pulp, then it is very painful and it can then go to your periodontal ligaments, which is in your root, which is attaching your root with your bone. So it can occasionally go to pulp and PDL, like periodontal ligament, if not treated in time. There can be 2-3 types of cracked teeth syndrome. First is cracked tooth. That is a vertical crack which runs from the biting surface of your tooth to your gum lines. And that's a complete cracked tooth. Sometimes a crack extends into your gum line and the root also. Then the thing is, next thing can be just the craze lines or hairline cracks. These are small, thin cracks which appear on the outer enamel of your tooth. It's not really the cracked tooth syndrome. You will feel that your tooth is cracked, but no, that is not a cracked tooth syndrome. That are only craze lines. Then you can have fractured cusp, like you have cusp on your molars. You have 4 cusp on your molars. One whole cusp can get fractured. So this also comes under your cracked tooth syndrome. The most common cause of this thing is age. When your teeth gets weaker and you're eating something and suddenly it gets cracked. So most commonly seen at the age of 50 and above. Then biting hard food. Sometimes you're eating a candy or sometimes some people have a habit of eating ice cubes or popcorns, anything hard, any nuts or something you can have. But yeah, that all depends on the quality of teeth you have. See, your oral hygiene is mainly for your tongue, your gums, your teeth, your plaque. But there is a quality of teeth which we already have by birth. That is genetics. So some have weak teeth and some have strong. So it is generally a tendency, if you eat something bite and your teeth are weak, you can have a cracked tooth syndrome. Then there are habits of like chewing gums. If you have a habit of chewing gums all the time, ice chewing, you can get cracked tooth syndrome. Then large dental fillings. If your fillings are overfilled, if dentists have leave you with overfills, then you can easily have cracked tooth syndrome, especially after root canal treatment. Then if you have a habit of bruxism, what is bruxism is night grinding. If you have a habit of night grinding, then also you can have this thing. Then if you have a trauma, you fall down or you have a physical injury to your teeth, you can have this. Mainly if you have a faulty crown and bridges also. It can happen after that also. If you have a faulty crown and bridges, you can have a cracked tooth syndrome and later it can lead to a very, very, very intense pain. Cracked tooth syndrome, first symptom would be that patient would feel very sharp pain when biting or when consuming something cold. So that time patient will feel a very sharp pain. And sometimes there's a rebound effect that sometimes some patients feel that on relieving bite, they are feeling pain. When you're biting, they are feeling relieved, and when they're releasing their bite, they are feeling pain. So it can be vice versa also. But yeah, first symptom would be history of sharp pain when biting or having some cold food. Then I would say sensitivity to thermal stimuli, that is also there present all the time. Like a patient will have hyperreactive action to hot or sugary stimuli. Many patients have seen that they eat sugar and they feel pain. So it can be that they have a cracked tooth syndrome. Then symptoms may present for periods ranging from weeks to months. So normally we ignore these symptoms. Like we have sensitivity, we'll use some Sensodyne, we'll use some sensitive paste, and we will ignore these symptoms. So it can be from weeks to months. So you have to be really careful about it, and you have to report to dentist as soon as you feel pain, sharp pain, especially after eating hot, sugary, and cold food. First diagnosis is thermal testing. As I told you, that teeth will become sensitive to your cold and hot stimuli. So first thing will be thermal testing. Then a careful history, we need to take a careful history, and we need to assess the symptoms, particularly cold sensitivity and sharp pain on biting, or tough or hard food which seizes on release of pressure. So it's an important indicator when patient tells us that they are feeling a relief on release of pressure. So that is a very important indicator for cracked tooth syndrome. We have to examine the gums for inflammation. If the infection is gone to periodontal ligament, if it is a vertical fracture, it can irritate gums. So that also has to be taken care. Then X-rays of your teeth are very important. These days we have X-ray is a 2D image. So we can see a limited thing in X-ray. These days we have CVCT, which is a 3D thing, which is CT of your mouth. It can easily be seen in those scans. So we can diagnose it, and then treatment would be bonding. We can use plastic resins to fill the fracture line and then cure it with a light. If the fracture is very intense, then we can go for root canal and crown. And if at all the things have gone from our hands, and the patient has delayed his visit to dentist, then we have to go for extractions or like complete removal of the tooth. First thing is they should avoid chewing hard food or ice, because it will only increase their pain. And people who have fractured teeth or cracked teeth, they know that they have it. So they should avoid chewing hard food or ice. Then they should practice good care, teeth and gum care. Both things are required. They can wear a mouth guard. There are mouth guards which are available, which we can customize according to your teeth size or your dentition size. So patients can wear mouth guards for that. Then they can wear night guards that are also very helpful in preventing cracked tooth syndrome. And more for very important thing is visit your dentist regularly. All you want to prevent any oral diseases, any types of oral cancers, any type of your gum diseases, you should visit your dentist regularly, at least twice a year.